Well, I think it's safe to say there is no bigger fearmonger than Dr. Norman Swan, the ABC's resident COVID boogeyman. Maybe he hates the fact that we've all moved on. He's got an addiction issue, addicted to peddling fear.
Either you care about 40 or 50 people dying a day, which is a 737 crashing at your local airport once a week, or it's somebody with an A-15 walking into a residential aged care home and shooting everybody in it every day. Either you care about that or you don't.
ABC's Dr. Norman Swan isn't concerned about the criticism. He's just focused on the data.
2022 has been the worst year of the pandemic for Australia. We've let things go and the virus has been unleashed.
If you think there's a lot of COVID about, you're right. Australia has a lot more cases per capita than any of the G7 countries. We're a global hotspot for COVID right now.
As soon as I open my mouth, there are people who say, oh, he's going to call for another lockdown. We're beyond lockdowns.
With more people in hospital, many more people in Australia are dying. At the end of last year, there had been 2,239 COVID deaths in Australia. Today, that figure has risen to 8,957. More than 6,000 people have died in the last 5 months, which is around 3 times as many deaths from COVID this year than in 2020 and 2021 combined.
It is one of the leading causes of death in Australia, and that should be a concern to everyone.
Professor Raina McIntyre is a world-leading expert on infectious disease. She doesn't propose another lockdown either.
My remit is to prevent illness, to prevent death and to protect people, and I don't think we're doing the best we can. With the COVID vaccines, having 2 doses gives you good protection for a few months, but it starts to wane.
Australia's uptake of the first 2 shots of COVID vaccines was world-class. 95% of us had 2 shots, but only about 70% of us have had 3. For children, the figures are worrying. Just over 50% of eligible kids have had 1 dose, and only 39% have had 2.
All the virus cares about is spreading to other people. So the virus will find us all. That's why not a single person watching this has either not been infected themselves or doesn't know somebody who's been infected, because we're all vulnerable to infection. What we're protected against, most of us, is severe infection.
But without an obvious national strategy on third vaccinations, the states are going it alone.
West Australia's the standout. They've done very well with 3rd doses. You need a 3rd dose. It's not a booster. It's actually the 3rd dose you were always meant to have.
And South Australia's new government has launched its own public health campaign.
I'm Mark, an intensive care doctor at the Royal Adelaide Hospital. If I can share just one piece of advice this winter, it's that being double vaxxed isn't fully vaxxed. Book your 3rd COVID shot now.
Some people are eligible for a 4th dose, and ATAGI has just expanded the indication for a 4th dose. So if you're eligible for a 4th dose, get it.
Raina emphasises that COVID-19 is an airborne virus.
It's not spread through rubbing it in your eye or touching things. It's spread through the air that you breathe. So just like you wouldn't drink a glass of water from the toilet bowl, nor too should you be breathing in dirty air.
I think there needs to be a change in the narrative from restrictions to protections. So a mask should be seen as a protection.
Kate Cole is a leading specialist in protecting people from airborne risks at work.
The best mask to wear to protect yourself this winter is an N95 or a P2 respirator.
Kate says these masks are more effective than cloth or surgical versions.
You can reuse it. You might just pop it on for 15 minutes to go in somewhere, you put it back in your handbag, you might use it again the next day.
Kate wants these type of masks provided free by the government, just like the US and Singapore have done. She and Raina don't want lockdowns. Instead, they want a national focus on ventilation.
The simplest thing is to open a window. If you think about people's exhaled breath, it's exactly like cigarette smoke. And the longer you're in that room, the greater your risk of getting infected.
Right now, there's no nationally coordinated effort to assess ventilation in all workplaces or schools, or to even set a safe standard.
We actually need a systematic approach to protecting children and creating a safe environment for them in schools. And nobody can object to safe indoor air for kids. That is an easy fix. The Victorian state government did it.
We asked all 9 of Australia's health ministers what they're doing to combat hospitalisations and deaths, and how they're going to increase vaccination rates and improve ventilation. The 5 responses we received are on our website.
I think we need to just be more pragmatic. We know that the hospitals are full of vaccinated people. How many of those hospitalisations could we prevent if we make antivirals easily accessible to everyone in the community?
We've got antiviral drugs that are pretty much 80% effective too at reducing severe disease beyond the vaccine. The question is, how many of the people who are dying are actually getting antivirals? We've failed to actually get these antivirals out to the people who are vulnerable. And if we did, 40 deaths a day could become 4 or 5 or 6.
But there's no guidelines telling GPs, here are the steps you can take with your patients. You can prescribe X, Y, and Z. There's nothing. You know, it's just a free-for-all. Everyone's just out there, you know, survival of the fittest.
The largest group of people who are dying are people in their 80s and above. And it's somehow that it doesn't matter if somebody in residential aged care dies. Well, it does. And it doesn't matter if somebody who's living at home and a bit frail dies. Well, it does. There's somebody's mum and dad, somebody's uncle and aunt, somebody's husband or wife.
The figure that stands out there is 6,000 deaths in 5 months. That's an extraordinarily high number of people. And those antiviral drugs, the messaging again from the central government, the federal government, has been pathetic. They're not even, I'm not talking about the new government, I'm talking about the previous government. No one ever told us about these antiviral drugs. I'm eligible for them because of my age, but I didn't know about it until I heard about it in the last 2 weeks.
So how do they work?
Well, if you've had COVID or you've got COVID, you can go to your GP, and if you're over a certain age, over 65, he can write you a script to get these antiviral drugs. It stops you getting the virus again.
Isn't that a matter, though, of educating the GPs rather? I mean, do we need the mass public health campaigns? That we've obviously gone through a period where the sort of communication of this stuff has been a daily part of our lives.
Yeah.
But surely that's not an ongoing thing, is it?
Well, I think we need a national ad campaign to tell people what they should be doing now.
Yeah.